So basically, the whole idea of this site actually came out of a considerable amount of work working with both the government as well as the owners and trying to convince that there are actually poor people who live in the city and that didn't seem to be going through. So that maybe we can do something about that. And so basically, the urban site is in Rawalpindi. We'll talk about it. It was set up by Akhtar Khan Resource Center, which many of you know, but for those who don't, is working on urban development and poverty reduction, but mainly focusing on economic empowerment, water and sanitation, and health, and very much focused through the agency of women. And the AHRC wants to establish collaborations both with the government, with interested actors such as NGOs and civil society organizations, but also development partners and finally academics both within Pakistan and internationally. And then to translate whatever development lessons, be they urban or rural, if to the extent we can, to actually write them up and to share them on forums such as today. So next please. So urbanization. This is a report from September 15 that World Bank came out, and we can go into details of how they did, but they found next that about 30% of Pakistanis live in an urban slum. As Dr. Anjum said, that yes, there's some issue of definition, and we can go into that in the later QA session, but that's what we're looking at. A third of the Pakistani population that's not really being programmed either by the government or by the owners or very much in the consciousness of most people who think about these people. Next please. So yeah, I mean, there's a growing urbanization. Same report says about 50 to 55% urbanization rates, half in the slums. There's a fair amount of hidden poverty, both because these people are not counted, so they don't receive services that they're not supposed to receive. Nobody's programmed for those services. There's lack of skills. The networks that at least people like myself and you take for granted for finding jobs, for improving our lives, maybe they're not really there to a large extent. And obviously health and education are all issues there. Urban spaces, or at least spaces, are very much part of the SDG agenda. It's SDG 11, but it really cuts across almost half of the SDGs out there. Next, please. So what's the idea? The idea is basically HKRC acts as a coordinating body. It works with the community. We're not talking to the community, we're talking with the community. And their ideas are driving a lot of our thinking. But then we actually provide liaison with all of the other actors in the field. Next, please. So, Bhokhasu, where the site is, it's actually on between Rawalpindi and Islamabad, just on the other side of IJP Road, behind People's Eye. That's kind of where it's at. Next. So we are researchers, so we thought about it from research angle. What do we know about this place? And the answer was not very much at all. So we did some research. So it's been about 2.5 years. It's not just been research, but a lot of this 2.5 years has been spent trying to figure out what this place is. Next. So the first question was, we went to the public sector and we asked, what is the population of this area? And they said, so maybe about 65 to 70,000 people. And we said, no, it looks a lot more than that. And so we did as population estimation using crowdsourcing. We're happy to share the methodology, but basically what we found is that the population is 235,000. So about 160,000 people who are not accounted for are not receiving those services. And so it shows up across so many different domains as we look at the data. So nearly 40,000 households, extremely high population density. I mean, I'll give you an example, comparison. New York City, which is the densest city in North America, is about 7,000. Average, there are areas obviously there are more, but really nobody is getting up below 25, 30,000 in most of the developing world. Calcutta, Dhaka, Bombay are definitely more populous, but that's what we're talking about. Extremely dense population with a fairly large number of people, and that's what the population is roughly like. That's what it is. It's 3 union councils divided into 16 mohallas of varying sizes. Polycolony is almost 48% of the total population. It's about a quarter of the area of the place. The rest of these are much smaller. It's interesting to think about it because, as Dr. Anju pointed out, and I think there were some comments, variations, huge variations even within these mohallas. So this is 1.5 square kilometers. You have variations that are some indicators go from 0 to 80% coverage between these mohallas. So behaviors vary, types of people vary, so on and so forth. So we started with a simple needs assessment, mentioned the community, started having some pick-up discussions with people. What kind of stuff you're interested in. Biggest need, jobs. We want livelihood, we want to put some food on our table. Unemployment is fairly high among men, higher still among women, and these are women who actually would like to work. Most of the time, we wanted to do health stuff, but they told us health is really not that much of a priority. But on the other hand, health is defined as curative, going to a doctor and getting treated for some medical condition. That's what's happening. It's happening fairly well. I'll show you how. But some of the public health indicators, such as immunization and family planning, not so much. Education is also there. Quality may be very poor, but things are happening. The local bodies governance system is starting to take hold, but it's still very, very sketchy. There are chairs of union councils who talk to a lot of people, but not so many. I mean, if you have about 80,000 people, how many people can you talk informally just in your day? Water and sanitation are issues. We'll talk some more about that. So basically that's an overview. Next, please. So one of the things that we wanted to talk about is if they're talking about economics in their lives, then what are they talking about economics in their lives? So did some micro investment planning tools we received from NRSP, so we're really grateful for that support. The forms are filled by women on behalf of their husbands, sons, or brothers. So aspirations may be mixed a little bit. But having said that, only about 20% of them have actually taken a loan previously. Most of their expense, rent is a major one. Almost 2/3 of the houses are rented. A little more than half have of the households have at least one working member, and 42% have two. Only about 2% households actually have no working members. Most of the wages are daily wages. There's no contracts. There are no jobs. I'm not going to get paid at the end of the month, and I have a job next month. Today is it. Tomorrow is the next is a brand new day. Job prospects of women, very much driven by, as Dr. Hadia said, issues of getting around outside the house. Security is a major issue, and very few women, as we'll show later, actually step out of the house. And people identified some of their major needs. Next. Then we went ahead and conducted a formal survey of facilities. So facilities, we wanted to find out the schools and healthcare providers. So there are 125 healthcare providers in this 1.5 square mile area. 76 of those 125 are actually in the premises of Tokasu. The other are in next over a union council that people can walk to. Almost half of them are actually doctors by their own accounts, MBBS. Few of them provide family planning services, virtually no, one or two of them support the government and WHO in immunization. 6 of them. Most care they give is curative, and most people find that they can actually pay what's being asked. They're just not happy with the care that they receive from these. Less than half of the women reported that their sister was educated as a proxy of. We felt that they would be hesitant to talk about their own education. Only about half felt that their parents would have supported their own education. Less than that, a little over a third, feel that they were consulted in household decisions such as education of the child. Only 30% can leave home for small personal tasks such as buying groceries without a chaperone or permission of a male.
Only 30% can leave home
without, they feel comfortable, so this is comfort. They may do it under duress, but yes. So it's very striking, right? And has implications for your employment ideas and potential. Most of them actually have a CNIC, very few of them have a bank account. Next please. About a third of them actually have some shape or form of saving. And it's interesting that, and this is consistent with some rural data that I've seen, but about 1/4 of them will invest in household assets, and another 1/4 will invest this in children's education. And of course, marriage of children is very important. Next. Family planning was asked. So national contraceptive prevalence rate, CPR, is 35%, Tokasu has the same, but unlike the national figure, virtually none of it is traditional methods. So these guys are using some form of modern method. It's just that most of it is condoms. Temporary, relatively unreliable method. Next please. So nationally, about 52% of deliveries happen now in a health facility. In Tokasu, that's about 59%. Unlike the public sector, nationally, public sector accounts for about a third, or about a little more than half of those facilities that happen at home. National figure is more close to about 12%. So they're in the city, they're actually using a government facility. So before, just another point, there is only one public sector health facility in the neighborhood, and that's a dispensary, and it's not open on most days, according to the media health result. So fairly low levels of public sector service provision, most of it is private sector. Also, we found there are 116 private schools and 3 government schools in the area. Sanitation wise, you can see some of these pictures. Streets are now most of them paved. They have sewage lanes on both sides, but they're open. They're lined, cemented sewage lanes that are open above. Municipal water comes in pretty much every other day. Roughly, it happens for about half an hour. Most people do not feel that that's actually safe for drinking, for which they turn to either filtration plant. There's one or two of them, but mostly to bores, water bores. There's 14 of them that we have been able to identify, put up by local influential people as part of their philanthropy and or public influence. That's available. It takes about 30 to 90 minutes to collect that, mainly because you have to go there. Lines are not terribly long, but it takes some time. It takes about 30 to 90 minutes a day to get water to drink. People do connect poor water quality to diseases, but mostly to hepatitis. They're not really sure if they're actually connected to the frequent diarrhea that we have documented in the community. So a lot of this information is being put out in public domain on our website. This is a summary sheet, kind of an infographic for the locus as a whole, and those on that side of the screen are the same things done at a mohalla level, at a neighborhood level. So basically, that's pretty much the data that we work with. I'm going to actually start describing a few of the interventions briefly that we've actually put together. HRC have. The first of them is supported by the USAID's Ambassador Fund, where local women who would have liked to work but are not currently working, a lot of them probably not work very formally in most places, were trained in entrepreneurial skills, trained to sell commodities to their neighbors, so soaps and clothes, pieces of clothing, or whatever else they could identify based on their interactions with their neighbors as things they can sell. So, and we mobilize them to become entrepreneurs. We call them RPs, and if you hear that term, I'm so glad that you have, because we hope that that term will become increasingly part of the development discourse. They create and cater to basically markets for staples at local level. We think that we can actually enhance that to increase some health supplies as well. So far, 23 women have been mobilized, and they've actually been earning between 3 and 10,000 rupees a month now. So it's starting to pull together. Next one is an intervention that's about to start, building on RPs themselves. The outreach that RPs are providing, we're actually training them in behavioral techniques to open up a dialogue with people who don't want to even talk about family planning, and then use some other behavioral techniques to recast family planning as a norm and not so much of an exception in the communities. NUST is our partner, and basically they are helping us with the behavior change techniques and training and so on and so forth. And then we're going to connect these women who want family planning to local providers. We do not want new things coming in. And with the public or private providers, and then provide feedback to those providers so that quality can be improved and maintained. And we think that this can be sustained through the previous thing that we talked about, RPs. They're selling things, they find it useful to basically devote time to these activities, in part because some of these referrals to local providers would be commercial in nature, and that's already happening for other things, for other health workers such as Dalian. So next. We have collaborated with NASTA students to basically do a survey of local employers and some local households to identify their needs and for the employers, as well as the skills and the skills needed and aspirations of potential employees. And we're trying to put together a portal so that we can connect them both to employers to employees, and employees to skill building organizations in the government, such as TEFTA and some of the foundations that work as CSOs doing imparting such skills. So that's actually just starting out. Next. And most recently, with support from the Asia Foundation, we've started some preliminary work on a citizens report card for water mostly, but a little bit on sanitation. We're also combining the report card with actual testing of water in drinking water sources at the point of collection. And we are in the next phase, that is next month, we will start a dialogue with local government officials, and then to basically have interactive monthly meetings with these people who come in with objective evidence of the quality of water that they're receiving, and basically engage in a dialogue about the services they receive. Also helping put together a national working group on urban water and sanitation as part of it. And finally, I think is a library corner. Idea is to have a safe space where children can come, read, to be read to, and basically learn to basically enjoy reading. They're also going to learn some basic computer skills. Basically, a library that runs in 2 shifts within the community that's not here right now. And we'll be piloting some things like robotics training and sessions and computer training sessions and so on and so forth. And hopefully this can actually even become daycare for women who can't afford to leave their children behind, and now are pulling their 7 and 8-year-old daughters to babysit their younger siblings. Hopefully this can actually be evolved into something like that. And obviously we'll be documenting these learnings and models. So basically, we're building all of this on Akami Khan's teaching, where he said that development can never happen from top-down approaches. It happens from within the communities, slowly, a little bit at a time. Little islands form, and he said that hopefully one day that one of those islands